Red alert at the world's airports. From Los Angeles, travel to destinations like Shanghai is no longer possible as the US has told its citizens not to travel to China. Medical authorities are working desperately to prevent the coronavirus spreading further. Now the World Health Organization has taken a strong stance.
The emergency committee almost unanimously concluded the novel coronavirus outbreak is a public health emergency of international concern.
That's because of an increasing number of cases of person-to-person transmission outside China, like in the US Midwestern city of Chicago. There, doctors are reporting the country's first case of one person infecting another with a virus on American soil.
Our newly confirmed patient is a man in his 60s, as you heard, the husband of our first confirmed case. He is also currently hospitalized and in stable condition.
The risks posed by the coronavirus mean authorities have been taking drastic measures to prevent its spread, like locking down this cruise ship in Civitavecchia, Italy, with thousands aboard because 2 passengers showed flu-like symptoms. They tested negative for the new virus.
My duty has been to adopt all these necessary measures because I'm responsible for my citizens and their health.
And that's the strategy being adopted by authorities in many countries, like here in Spain. Strict quarantines at this military hospital are planned for Spaniards returning from China. The hope is that secure facilities like this one can keep the virus at bay.
Okay, let's get more information now with Tarek Yasarevich from the World Health Organization itself. Mr. Yasarevich, thanks so much for coming in today. The WHO has issued a global emergency warning for the coronavirus, but no travel ban. What's behind that decision?
Thank you very much for having me in your program. So as you have said, we have declared novel coronavirus outbreak as a public health emergency of a national concern. This means basically enhancing international cooperation and making sure that all countries around the world follow WHO recommendations. And we sort of harmonize the actions we are taking. As you have said, we are not advising any travel or trade restrictions at this stage. But obviously, we know that countries may take measures for containment and mitigations. So what is really important to remember here is that we are all into this together. The WHO is issuing guidance to countries. Now we have a formal temporary recommendations to all countries, those who are affected the most, and in this case it's China, but also neighboring countries and other countries. It's important that all countries work together on one hand to make sure that we get the knowledge we still don't have about the virus, and on the other hand, that the health systems around the world are ready to quickly detect and respond to any imported cases.
Okay, working together more coordinatedly, getting together on this on a global level. What needs to be done first off, quickly, to contain this virus?
Well, first, really, we have to understand the virus. We still don't know its exact severity. We still don't know exactly how easily it's being transmitted from one person to another. We know this is the coronavirus. We know it's being transmitted through droplets, but how easily this is being done, it's still being looked at. We don't know what are the most affected parts of the population. We have seen that the majority of those who died are elderly people with underlying health conditions. And what's really important, we still don't know what is the source. We know that it's in an animal world, but we don't know what is exactly. We want really that everyone in the health world, in the global health community, prepare for this, and that every country has enough of resources and enough of technical knowledge to quickly, basically, detect people who may be sick, to test them, and to be able to provide them medical care.
Tarek Yasarevich from the World Health Organization, thanks so much for giving us those insights this morning. Well, meanwhile, in China, the Lunar New Year holiday was supposed to come to an end. Instead, it's been extended with travel restrictions and lockdowns in many cities across the country remaining in place. The vast majority of the nearly 10,000 coronavirus cases are in China's Hubei province and the city of Wuhan, of course, the epicenter of this outbreak. People there remain on high alert.
On the border with Hubei province, where the virus first emerged, few are braving the streets. Many shops are closed and town centres deserted. Residents are cautious.
Normally, I don't want to go out, but today I felt that I'd been at home for quite a few days, so I went out to get some sunshine and go for a short walk in this small area. But I didn't dare go too far.
Normally at this time of year, a lot of people come here. Now there's nobody. Normally there are at least a few thousand people walking about here.
The latest figures from Chinese health authorities show the number of cases are rising. Nearly 10,000 people are infected in the country, and over 200 people have died. And as several airlines suspend services in and out of China, governments have started flying their citizens out of the city Wuhan, the center of the crisis.
Today, my government told me I have to go to the airport. I think there will be made a small medical check from the Chinese government. I'm not sure. Then I think I will fly to Germany, and after this I will be isolated and for 2 weeks.
For Wuhan's locals, life goes on, but with ever-present precautions.